Welcome to this video, where I will give you an overview of safe bottle feeding and aspiration prevention for parents. In this video, I will provide helpful tips on how to safely bottle feed your baby and prevent any potential dangers associated with it. 1. What safety measures should I take when bottle feeding my baby? When bottle feeding your baby, it is important to take certain safety measures to prevent aspiration or choking. You should always ensure that the bottle and nipples are clean before use. It is also essential to hold your baby in an upright position while feeding them and avoid any sudden body movements. Additionally, you should make sure that the nipple hole size is appropriate for your baby's age and check if they are having proper suction while drinking from the bottle. 2. How can I ensure that my baby is getting the right amount of milk while bottle feeding? When it comes to ensuring your baby is getting the right amount of milk while bottle feeding, there are a few things you can do. Try using a measuring cup or syringe to measure the exact amount of formula that you want to give your baby each time. That way, you'll be able to ensure they are getting the correct amount and not too much. You should also make sure to pay attention when your baby is drinking from the bottle and stop them if they start to show signs of being full, such as turning their head away from the bottle or falling asleep mid-feed. Lastly, keep track of how much milk your baby has consumed by writing down all feedings and amounts given in a notebook or on paper. 3. Are there any risks associated with bottle feeding a baby? Yes, there are some risks associated with bottle feeding a baby. The most common and serious risk is aspiration, the inhalation of milk or formula into the lungs. This can lead to choking, coughing, gagging, wheezing, and even pneumonia. To help prevent this from happening, always make sure that your baby is in an upright position for feedings, and do not prop bottles up with pillows, as this can cause them to flow too quickly. Also, be sure to use only sterilized nipples and bottles and discard any that are cracked or worn down. Lastly, be sure to burp your baby regularly during feedings so they don't swallow too much air. 4. What are some good techniques to prevent aspiration and to choke while bottle feeding? The following techniques can help to prevent aspiration and to choke while bottle feeding. 1. Hold the baby upright and in an upright position when feeding. This will reduce the chances of them taking in too much milk too quickly, which can cause choking or aspiration. 2. Never prop a baby's bottle up, as this puts them at risk of aspirating fluids into their lungs. Instead, hold the baby close to your body with one hand beneath their chin-neck area, supporting the back of their head and neck with your other hand. 3. Make sure that the nipple is properly inserted into the bottle before beginning to feed so that milk does not leak out during feeding. This could be aspirated by the baby if it is too close to their nose or mouth. 4. Check the temperature of the milk before feeding. It should be warm but not too hot, as this could cause burns in the baby's throat if aspirated. 5. Whenever possible, use a slow flow nipple on the bottle to ensure that milk is released gradually and at a safe rate for the baby to swallow without choking or aspirating milk. 6. Monitor how much your baby is drinking during feedings. Too much milk can overload them and put them at risk for aspiration. If they begin to choke, quickly remove the nipple from their mouth and try burping them before continuing with the feeding. 7. Take breaks between sucks so that the baby can swallow any milk that may have been aspirated. 8. If your baby is having difficulty with bottle feeding, talk to a healthcare professional to determine if there are underlying medical reasons behind their struggles and get advice on how best to proceed. 9. Make sure to sterilize all bottles and nipples before each use. This will help reduce the risk of infection if any milk were to be aspirated. 5. How often should I change the bottles and nipples when bottle feeding my baby? It is important to change the bottles and nipples regularly when bottle feeding your baby. This helps ensure that they remain clean and free of bacteria, which can cause illnesses in babies. The American Academy of Pediatrics recommends washing all bottles and nipples between each feeding or up to 4 times a day with hot soapy water. Make sure you rinse the soap off thoroughly, then air dry on a clean towel before reusing them. Discard any cracked or worn out bottles and nipples that are more than 3 months old. You should also sterilize all new bottles and nipples before first use by boiling them for 5 minutes in a large pot of water. Finally, make sure you check manufacturer instructions frequently for information about maintenance recommendations related to your specific bottle and nipple. 6. What should I do if I notice signs of aspiration in my baby after they have been fed from a bottle? If you notice any signs of aspiration in your baby after they have been fed from a bottle, contact their healthcare provider right away. The symptoms may include coughing while they are eating, difficulty breathing, wheezing, fever, and/or chest congestion. If the problem doesn't resolve quickly or you suspect that it is something more serious than an aspiration, take your baby to the emergency room or call 911 for immediate medical attention. In some cases, aspiration can lead to pneumonia or other life-threatening complications. It's important to address any issues with feeding as soon as possible. 7. Are there any special considerations for premature babies or those with certain medical conditions while bottle-fed? Yes, premature babies or those with certain medical conditions often require special considerations while bottle feeding. Babies at risk of aspiration should be monitored closely during feedings and may need to be positioned differently, such as in an upright position or on their side, rather than lying flat on their back. They may also need to be fed more slowly or for shorter periods of time than other babies. It is important to always follow the advice of your baby's doctor regarding feeding techniques that are best for your child's particular needs. Additionally, if your baby experiences any signs or symptoms associated with aspiration, seek medical attention immediately. We hope this guide has provided you with a better understanding of safe bottle feeding and aspiration prevention. Remember, always consult your pediatrician before making any changes to your baby's diet or routine. If you have any questions or feedback about what we discussed today, please leave us a comment below. Don't forget to subscribe for more helpful tips on parenting. Thanks for watching.